In heart transplant recipients, what typically happens to cardiac reserve? A. It remains permanently impaired. B. It gradually improves over time. C. It is immediately restored to normal levels. D. It fluctuates unpredictably. Answer: B. It gradually improves over time. Which physiological response is a part of compensatory mechanisms to maintain cardiac reserve in heart failure? A. Increased parasympathetic activity. B. Activation of the renin-angiotensin-aldosterone system, RAAS. C. Decreased ventricular remodeling. D. Reduced sympathetic stimulation. Answer: B. Activation of the renin-angiotensin-aldosterone system, RAAS. In the context of cardiac reserve, what is the significance of the ejection fraction, EF? A. It directly measures cardiac output. B. It indicates the heart's ability to fill with blood. C. It reflects the percentage of blood ejected from the ventricles with each beat. D. It measures the pressure in the pulmonary arteries. Answer: C. It reflects the percentage of blood ejected from the ventricles with each beat. Which diagnostic test can provide a quantitative assessment of cardiac reserve? A. Resting ECG. B. Cardiac MRI during stress. C. Holter monitoring. D. Chest X-ray. Answer: B. Cardiac MRI during stress. Which hormone, when chronically elevated, can negatively impact cardiac reserve by promoting cardiac hypertrophy and fibrosis? A. Insulin. B. Epinephrine. C. Aldosterone. D. Glucagon. Answer: C. Aldosterone. During which condition is cardiac reserve most likely to be acutely utilized? A. Sleeping. B. Sitting quietly. C. Running a marathon. D. Watching television. Answer: C. Running a marathon. Which factor contributes to a higher cardiac reserve in athletes compared to non-athletes? A. Lower resting heart rate. B. Higher blood viscosity. C. Lower stroke volume. D. Increased peripheral resistance. Answer: Lower resting heart rate. How does tachycardia affect cardiac reserve? A. It increases cardiac reserve by enhancing myocardial perfusion. B. It has no effect on cardiac reserve. C. It decreases cardiac reserve by reducing diastolic filling time. D. It decreases cardiac reserve by increasing afterload. Answer: C. It decreases cardiac reserve by reducing diastolic filling time. In patients with dilated cardiomyopathy, what is the primary reason for reduced cardiac reserve? A. Increased ventricular contractility. B. Decreased ventricular volume. C. Impaired myocardial contractility. D. Increased heart rate. Answer: C. Impaired myocardial contractility. Which physiological response occurs to maintain cardiac output in the setting of reduced cardiac reserve? A. Decreased blood volume. B. Decreased sympathetic nervous system activity. C. Increased peripheral vasoconstriction. D. Decreased heart rate. Answer: C. Increased peripheral vasoconstriction.